about sort of kind of the appropriate way to address various types of situations. The other thing that's important, and I've got down here, to describe your findings using appropriate medical terminology, you're at the start, well, actually, I guess you're not at the start, you're in the middle of the start of a long journey of us brainwashing you into doing what we want. That is to say, as you as you move forward through this in the realm of medical sciences, in the same way that physicians and dentists talk with a specific lingo, so do veterinarians, and that's going to be important that you're familiar with that lingo, is particularly for having conversations with your colleagues. The fun part about veterinary medicine is that you then have to also translate some of those advanced medical theories into language that your owners can understand. And so that's also part of the fun and the challenge, but that will be covered in your communications class. So we can talk fancy in this class if you want. Good. And so when we talk about triage, triage is essentially, if I could crystallize it, it is essentially a very rapid assessment that is giving you an idea of how sick a particular patient is. And if during your triage exam, which is also called the primary survey, if you identify life-threatening problems, then you do not continue with the rest of your primary survey. You immediately intervene to try and fix those primary problems. And so the way I've structured this lecture is we'll talk a little bit about one area of triage, and then immediately after we sort of talk about the abnormalities, we'll talk about how we go about stabilizing those patients, and then we'll kind of move on to the next one. So there will kind of be a little bit of a back and forth during this lecture. And so, as I said, the primary survey is going to be a little bit different from doing a full physical exam on a patient. It is a rapid, focused assessment, essentially asking the question, is this pet going to die in the next 20 minutes, 30 minutes, something like that? Is there something I need to take action on right away? If we identify something that requires that is a life-threatening problem, we then kind of move on to means to stabilize that patient. So we do not necessarily do a full physical exam if we identify something that requires immediate stabilization on one of the other systems. The secondary survey is more what you're used to with regards to a full physical exam, abdominal palpation, maybe making sure the musculoskeletal system's okay. It is also an opportunity to pursue further diagnostics, but really, in the secondary survey, we are primarily focused on the less critical systems, GI tract, musculoskeletal, stuff like that, stuff that's not going to cause immediate trouble if it's broken. And so, the four systems that we focus on during our primary survey are listed here: respiratory, cardiovascular, the neurologic system, and the urogenital system. And I put the stopwatch here to remind me that ideally, your primary survey will not take more than 2 minutes. So that's something that, again, to me, just kind of emphasizes the fact that this is a rapid assessment, essentially trying to figure out. And if you go back to kind of the origins of the word triage, it's kind of came from a battleground scenario, but the real question that you're asking is, how sick is this person? Can I treat, is there someone else who's sicker that I need to treat before this person? For the same way that if you go into an emergency room and you've got a stubbed toe and someone comes in and is having a heart attack, even though you got there first, they're going to trump you and be seen first. And so that's essentially what your primary survey is determining. The other thing that you can get generally as part of a primary survey is, and this is something that will come with practice, is you can get a quick thumbnail history of what's going on, which in the emergency room context is basically, why are you here? What has caused you to bring your pet in tonight? What seems to be the problem? And some people, if you talk to them and you make the mistake of asking them sort of what the problem with their pet is, they can talk for 20, 30 minutes. And so really what you're getting down to, the nitty gritty, is really, why are you here tonight? What aspect of your pet prompted you to bring them into the emergency room to be seen? The other question I like to ask if I have time is, can you tell me when your pet was last normal? And so obviously everyone's description of or idea of normal is a little bit variable, but at the end of the day, what you're really trying to get a handle on is this an acute problem or is this a chronic problem? Has the pet been like, was totally normal until 5 p.m. and is now comatose? That's important to know, as opposed to, oh, well, this pet has never been normal, and in fact, it's had a brain tumor, and we were expecting to come in comatose this evening. You know, something like that just kind of gives you a little bit more context as the clinician. Also, what we're going to get from our primary survey is we're going to get our initial problem list. And so you all, I think, have had a little bit of practice generating problem lists and differential diagnoses. This is also going to be one of those like little brainwashing things that you're going to get really sick of by the time you're a senior, but we still do it anyway. The initial problem list is really easy to generate because it's basically just list all of the abnormalities. And then we keep it really basic. We don't want to overthink this, because if you overthink it and you get down a little bit too specific, you may miss other problems. I'll give you some examples a little bit later on. Okay, so the first, you have this chart in your notes. It is really, really good to practice to touch as many pets as you can. You know, touch your pets, touch your friends' pets, ask permission first, but you know, palpating pulses, you're sitting there on the couch watching TV, just kind of sneak your hand over a little bit, do a little palpation of the femoral artery, because what you're doing is you're basically building a your data bank, right? You're building you're feeling all of the variability or all of the variation that could be considered normal pulses, normal respiratory rate, normal respiratory noise. Because then when you see an animal roll into a clinic that is having abnormal pulses or heart rate or noise, it's going to be easier for you to distinguish that. So really, all I'm saying is touch absolutely everything you can and start building your mental database of what a normal animal looks like, what a normal pulse feels like, all of those sorts of things. I'm one of those people that had, like, when I grew up, like we had a fish, and you know, like surprisingly, it was like the same fish for all 20 years that I was at home. You know, every once in a while, the spots would change a little bit, especially after vacation, and maybe someone forgetting to feed it. Like all of a sudden, it was always the same fish though. But I never had a dog before I got to vet school, and then all of a sudden we have to do all these physical exams and this and that. I mean, not to mention learning how to touch a cat or learning how to walk a horse. And like all of that was really abnormal. Well, it wasn't abnormal, but I was unfamiliar with it. And so it really, I personally had to do a lot more work on this than I think someone, if you've grown up with pets all your life and have been observing animals, so on and so forth. But you can assess your level of comfort with stating these normal exam parameters. Okay, so let's dive in. Respiratory assessment. Well, welcome to Georgia. This is like what I got to Georgia and they're like, oh, your first patient's waiting for you there in the cage. And it was like this. It was like, perfect. I have arrived. Anyway, three aspects that are important when we talk about the assessment of the respiratory system are the respiratory rate, respiratory effort, and then also respiratory pattern. Talking about rate of respiration, here's some of these medical terms for you to work through. So decreased rate of respiration, technically, I guess you could use the term bradypnea. I have personally never used it in my life, but since we're going to be fancy and medical, more concerning for me, especially in the emergency room, is apnea, which is the complete absence of respiration. And that is obviously something that if you saw that on your triage exam, you would very rapidly need to intervene to fix that problem. Things that can cause slower than normal respiratory rate can include central nervous system disease. We'll see it a lot in animals recovering from anesthesia. because some of those drugs that we use can be potent respiratory depressants. And then increased rates, tachypnea. We use this a lot. Tachypnea can result from low blood oxygen levels, right? So if you have lung disease or if you have airway disease that prevents adequate amounts of oxygen from getting into your lungs, you may be tachypnic because you are hypoxemic, which implies that you have low oxygen levels in your blood, right? Emic is in your blood. I've heard other people use it in the context of hypomarguritemic at a Mexican restaurant. But EMEA or emic is always in the blood. And so in this case, we are hype, low, oxygen, hypoxemic. Other things that can cause tachypnea, pain, fever, cardiac disease, so heart failure. Frequently animals have tachycardia and tachypnea if they're in heart failure. And then also the dog may be nervous. And so I put that in because tachypnea is also a little bit situationally dependent, right? You could have a dog who's just extremely nervous. And so on your physical exam, on your triage exam, you're going to note that the dog is panting or tachypnic, but you sort of take that into account with the rest of the dog. And that may not be a failure, an abnormality from a triage exam that requires further investigation at that point. This guy is real loud. So he's making a honking noise every time he breathes. And so this is a Yorkie with a condition called tracheal collapse. But what I'm really using him to show here is we will also evaluate the effort, respiratory effort, and respiratory pattern. And one of the things that happens when you have upper airway disease, specifically upper airway obstruction, is generally you breathe quite noisily. And again, just like the panting dog who might be nervous, you could have a bulldog who is, even when they're quote unquote normal, they breathe extraordinarily loudly. And so you don't necessarily think of a bulldog coming in with a lot of respiratory noise as being abnormal. But if a Labrador retriever came in and was making noises like a bulldog when it was breathing, then that may also push you to triage that animal for some further diagnostics or stabilization. We can see, and so Dr. Koenig, I think, has a lecture on this as well, just talking about respiratory patterns, but suffice it to say, if you have an obstruction in your upper airway, you tend to take very, 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 very long inspirations because you are breathing past something that has decreased the, your tracheal diameter goes from this to that. And so, and if you're bored, you can try breathing through a straw for a little bit, but some of these animals who have tracheal disease are breathing through a very, very small airway and consequently need to focus more on inspiration. Alternatively, animals who have lower airway disease, so something like asthma, actually spend a lot of time exhaling. And so sometimes you can see this on your triage exam. Sometimes you don't really appreciate it until you can sit and stare at an animal for a long period of time and really see the patterns. But in general, animals with, that are not brachycephalics who come in making a lot of noise while they're breathing generally are triaged for some further diagnostics. We kind of ask the owners if we might be able to borrow their pet for a little bit and just check their blood oxygen levels and things like that. This is a dog who's not having, as opposed to the Yorkie who was having a little bit of inspiratory troubles, this dog is just having troubles in general. You can see he's also orthopnic. He's got his 2 feet sort of spread apart like that, trying to make his bulldog trachea as large as possible. This is a dog with pneumonia. And so he is just having what I would characterize as dyspnea, which means difficulty breathing, but it is not characterized as to, inspiratory or expiratory or anything. He's just having trouble breathing. Here's another picture, 2 other dogs that have orthopnea. And so again, orthopnea is just positioning. You can see their neck is really, really stretched out. Their feet are kind of wide based. and that is to try and increase the tracheal diameter as much as possible so that they can get as much air in as possible. This dog came in like this, and he's interesting because he's not particularly distressed, right? He's just looking at you, but every time he inhales, he makes that crazy high-pitched noise. And so this is a dog that actually had a congenital condition called laryngeal collapse. And so his larynx, again, instead of being a nice wide larynx, had collapsed. And so he was breathing through a very, very small aperture compared to what he should be breathing from. But it was chronic, and he, because it was congenital. And so this was something that he didn't see a particular problem with, but he's at home, and the owners actually brought him in because he was making this whistling noise every time he would breathe. Cats, as a rule, are too dignified to pant. If you have a cat who is open mouth breathing on your triage exam, that is probably something that should immediately be brought back and have some oxygen administered. This is a cat who was triaged, who came in, who was panting, and you can see he's currently kind of sitting. All of these have plexiglass, all of these photos, because he is currently in an oxygen cage. And you can see it's not necessarily making a huge difference just yet. So in general, cats too dignified to open mouth breathe. Okay, so what do we do? So let's say we identify, we've got these patients, we say, holy cow, I think there's a problem with your respiratory system. Can we borrow your pet and do a little bit more investigation? And so action-wise, one of the first things to do is to administer supplemental oxygen. And we have a ton of different ways to do that. So this guy here is hanging out in an oxygen cage. And so we're breathing right now 21% oxygen. In the oxygen cage, we can administer up to 40% oxygen. And so we can make it a lot easier for these animals to breathe by giving them an elevated concentration of oxygen. We can also use masks, right? So mask oxygen is, sorry, I didn't have like a dog, but works in anteaters or dogs. But basically, we have these tight-fitting masks, and we can give oxygen that way. This guy is sedated, so he's tolerating it pretty well. In terms of other mask oxygen, sometimes if animals are really stressed out, they may or may not tolerate the mask in front of their face. We can throw in some nasal prongs. So these are exactly what they use in humans. So like if you go to the hospital and they give you a little supplemental oxygen, if you go to like one of those oxygen bars, if those things still exist, they're super easy to do. And in the context of many pets, we can just pop them in the nose and they will tolerate it, especially if they are kind of out of it. This dog happens to be awake, and he's probably one of the rare dogs that tolerates these in an awake animal. Okay, the other thing we need to do, so we're giving oxygen because that's sort of one way or another, we don't know where the primary problem is, but they're having difficulty breathing. We're going to give them oxygen while we figure out what's going on. And so once you've got the oxygen going, you can then move on, and auscultation is not part of your primary survey. Your primary survey is primarily just observational. You're listening and you're watching the respiratory rate. You're not pulling out your stethoscope. You're not doing advanced diagnostics. You're just seeing their rate and rhythm and effort. But if you decide that there's a problem with the respiratory system, then you can take this next step while you're giving them some oxygen to help stabilize them, auscult them, pull out your stethoscope, see if you can figure out why the animals are having difficulty breathing. And then, basically after that, we can observe them. You notice the clever thing is we made the front of those oxygen cages clear. That was pretty clever, right? So you can actually have an animal in there, be treating them with an elevated inspiratory oxygen concentration, and also kind of see what's happening, see if they have a different respiratory pattern, see if there's something that will clue you into the cause of their problem. If we need to intervene, so in animals who have fluid, for instance, around their lungs, we can intervene doing a thoracocentesis or something else if we identify that that's the problem. Okay, questions about respiratory stuff. So again, rate, rhythm, effort is really what we're looking at, and noise. So we're listening, we're observing, and if we determine that an animal is having too much difficulty breathing, we'll at least bring them back, give them some oxygen, and then try and figure out what the primary cause is.
I have a
Cardiovascular,
question.
yeah, go ahead.
So I don't remember all of the details. They're a little hazy, but I do remember in respiratory physiology, we briefly talked about how some conditions like aren't really going to be improved by oxygen administration. So do
Yeah,
you just kind of do that because like in all cases, like it won't hurt necessarily, but might help?
correct. Yes, it is. The only time oxygen supplementation may hurt is in well, it's never been reported in veterinary medicine, but in humans who have chronic respiratory disease, such that the main driver of their inspiration is low oxygen in their blood. If you give them oxygen, they lose that driver and they stop breathing. So these are people who are chronically have high carbon dioxide levels. It's really, we don't see that in veterinary medicine. So yeah, by and large, we'll give them oxygen. I mean, obviously, if there's an obstruction here, us giving them oxygen is not necessarily going to improve. If we can't increase the amount of flow past the obstruction, they may still have a situation where oxygen isn't going to be helpful. But as you say, it's not going to be something that's going to cause a problem generally. And the biggest issue that we have is if we use the oxygen cages, then we have this animal who's behind plexiglass now, and we can't do as much in terms of physical exam and other things that we may need to do. And so that sometimes informs our choice about whether we try and do a mask versus just put them in the oxygen cage to start with. But think about what happens, right? You are a cat. Imagine for a second, right? Owner comes home, says, "Holy cow, you're having difficulty breathing," freaks out, runs around the house looking for the carrier, finds the carrier in the garage, brushes out the cobwebs, grabs the cat, sticks the cat in the carrier, puts the carrier in the back of the car, drives erratically to the veterinarian, pulls the carrier out, pulls the cat out, puts the cat on a metal table. Like all of that is not non-stressful, right? Like that in and of itself can be really stressful. And so sometimes what we end up doing is we're saying, let's just put you in the oxygen cage. It's quiet, it's temperature controlled, no one's going to touch you. We'll just observe you and try and understand what's going on. And so, sometimes we use it as much as a tool as anything, but by giving them at least an elevated concentration of oxygen, if they really do have pulmonary disease, they'll know we'll be at least helping them from that perspective. Cool. So let's talk about the cardiovascular system. Cardiovascular triage does involve touching the patient, but not that much. We're going to generally pose questions that have to do with oxygenation and perfusion, because really we're trying to understand, is the heart working appropriately? And so one of the first things we do is approach the animal and we'll take a look at the mucous membranes. And so we're going to do a little CRT here, right? So we'll push down with the finger to blanch the mucous membranes, then lift our finger up and see how long it takes for that color to return, right? So here we go. We're going to blanch it, and that returns relatively quickly. A normal capillary refill time is about 1.5 seconds. Now, capillary refill times can be too slow. So if the heart is not pumping well, it may take longer for that color to return to the membranes. Capillary refill times can also be too fast. And so the incorrect answer when someone says, "What's the capillary refill time?" and you say less than 2 seconds is incorrect, because although normal is less than 2 seconds, if it's actually 0.5 seconds, that is abnormal. And so get in the habit of really stopping and thinking, not necessarily, "Oh, the blood came back, we're all good." Did the blood come back in an appropriate time, or was it too fast? The other thing we can look at here is we can also assess the mucous membrane color while we're kind of looking at it. And so this is actually, I've listed here all of the things that we're assessing in our cardiovascular triage. So mucous membranes color, capillary refill time, and then the other thing that we're going to do is we're going to assess the pulse quality. And while we're feeling the pulses, we're going to also get an idea of the heart rate. So the cardiovascular triage is probably the most hands-on part of your triage. In fact, you can do, and this is as you practice more, you'll get into a rhythm. My respiratory triage is basically completed by the time I've walked across the waiting room to the dog, if it's a dog, right? Because you're looking for noise, you're looking for posture, you're looking for respiratory rate. I can do all of that as I'm walking towards the animal in the waiting room. And then if it's a dog, you go ahead, you pat the dog on the head, you lift the lip, look at the mucous membrane color, push the gums, look at your capillary refill time. And then generally I will go ahead and I usually run my hand down their back just because it's polite, because the next thing you're going to do is basically reach into their groin and try and palpate their femoral pulses. And so just to kind of give them a heads up that you're there. Cats, it can be a little bit difficult because they're usually in carriers, but it's still the same kind of thing. You peek in the carrier, look at the mucous membranes color, look at the CRT, and then go back and palpate the femoral pulses. Horses, conveniently, you can palpate the pulse at the same time that you're looking at the CRT and doing all that stuff around the head. So here's, technique. We just kind of covered that. So remember, mucous membranes come in all shapes and sizes. This hound has some pigmented mucous membrane, so it's going to be difficult to assess the CRT in the area where it's pigmented. We can see cyanosis. This is a tongue, I realize, but sometimes we can see bluish mucous membranes. This is generally in animals that have very, very low amounts of oxygen in their blood. We can see icterus. Icteric mucous membranes are also called jaundice, but they're basically indicating that there might be some problem with hepatic clearance of bilirubin. Also, take a look at this dog up here. You can also see a sclera are icteric too. So really a classic example of icterus. Pale. This is a big one on the emergency room, right? A lot of times we're trying to assess if an animal's in shock, are they in shock due to blood loss, for instance? And so pale mucous membranes, and look how, as an aside, look at that tongue. I mean, the tongue is essentially white. So this dog has a severe acute anemia due to hemorrhage. These are hyperemic, and it's not an awesome photo, but this dog actually has gum disease, which is why his gums are hyperemic here. They're just redder than pink. But we can also see that in the context of septic shock as well. So if you see red mucous membranes and it has a really, really fast capillary refill time, that is also abnormal. I should probably get another one of this. Methemoglobinemia is a rare one. Generally, we only see it in the context of Tylenol intoxication in cats, but they get kind of a brownish color to their mucous membranes, and that's kind of what I was trying to show here. This cat was sick. Okay, there's another nice pale mucous membranes there. Okay, femoral pulses, pulse palpation. We're looking for the rate and we're looking for the rhythm. I don't necessarily on my triage exam count a pulse rate, but I do kind of have in my mind an idea of, oh, this seems about right. This seems too fast. This seems too slow. And that's sort of what I'm thinking. Also, you can assess the quality. A normal pulse should have a really round character to it. You should palpate the pulse. You'll feel it go up, and you'll feel it go down. If an animal has an increase in their cardiac output, such that their heart rate is elevated and they're pumping a lot more, their cardiac output is high, you may palpate what's called a bounding pulse, which means that your systolic blood pressure is much higher than your diastolic blood pressure. Because at the end of the day, when you're palpating a pulse, you're actually palpating the difference between your systolic pressure and your diastolic pressure. So you can't actually diagnose hypertension by palpating a pulse, because 120 over 70 is going to feel the same as 220 over 170. But if you had 220 over 70, that pulse would feel extraordinarily strong and bounding. The opposite of that is a weak pulse or a thready pulse, which is a pulse where it's difficult to feel. You don't get that nice round lift. You just get kind of a little flick when you're trying to palpate it, and that's it. Femoral pulse is nice, but keep in mind we have pulses pretty much everywhere. It's also good practice, as you're sitting there, and if you have pets sitting next to you on the couch, go ahead and palpate some additional pulses. This metatarsal pulse is a really nice pulse, hard in standing animals, but really nice in animals that are lying down. The other place you can palpate is right over the heart, right? If you can't feel a femoral pulse, you can put your hand right on the animal's chest and just see if you can palpate something. Just a brief note about skin turgor. I sort of threw this in with cardiovascular, but it's not really cardiovascular. But elevated skin turgor, or to measure skin turgor, you basically lift the skin up between the shoulder blades and then let go. And under most circumstances, that skin will lift up and then very quickly go back to where it was. And that is normal hydration. This is a Rottweiler who had very abnormal hydration. He had severe hypovolemia and dehydration due to parvovirus, but we did a skin tent. And I mean, honestly, like a family of 3 could camp in this tent. This skin tent was going nowhere. This dog was so dry. Okay, so what do we do if we're worried about the cardiovascular system? Again, a lot of times if there's a heart problem, oxygen is a good first step, because really all we care about in critical care is oxygen delivery to tissues. And we need to make sure that there's enough oxygen delivery to keep the tissues happy and doing their whole aerobic respiration thing. If we feel an irregular pulse when we were palpating the pulse, we may want to look at it with an ECG to see if there's any sort of arrhythmias present, to see what it looks like. If we think an animal is hypovolemic, we may also treat it using IV fluids. If an animal needs sedation, we may, jump in there. But there are a lot of different considerations based, kind of, quite honestly, based on what we find in our secondary survey. Because really, your secondary survey, remember, is you answering the question of, okay, we know there's a primary problem with the cardiovascular system. Let's find out what's causing it and then fix it. Here's a dog. He's called Bubba. I'm going to move a little fast because I spent too much time talking, which I usually do. He presented to the emergency room for collapse. His physical exam, he had pale mucous membranes. His heart rate was 210, and his pulses were weak, making us think that maybe this was a dog who did not have enough blood volume to pump around, but he's a Great Dane. So he also could have been in heart failure, because they can get dilated cardiomyopathies. And so they could be having problems actually physically pumping the blood. But we were concerned, especially given his pale mucous membranes, that he may have had some blood loss. We know that he has arthritis and was taking arthritis medications. And so here's kind of what we came up with. So on our triage exam, we come up with a problem list. And what I want to highlight to you is that this problem list is crazy nonspecific, right? All this problem list is doing is restating the problems that we identified on our triage. So we noted he was tachycardic, he was tachypnic, he had pale mucous membranes, and then we know that the owner brought him in because he had collapse, and we know that he has a history of arthritis. Okay, so your problem list is nothing fancy. It is just helping you organize your thoughts, because what we're then going to do is we're going to say, okay, let's come up with diseases that can cause tachycardia and pale mucous membranes at the same time. And that's how we're going to develop our differential diagnoses to treat. Okay, keep Bubba in mind. We're just going to do a quick neurologic triage. Sometimes the presence of neurologic disease is not subtle. This cat obviously had a little adverse interaction with a vehicle and came in with some pretty significant external evidence of neurologic disease. He's also got epistaxis, but you can see he's got a facial droop here. So he's in general, he certainly, I suspect, has a headache. The other things we look at in neurologic triage are mentation. Again, we are not doing a full neurologic exam here. We are doing a very, very brief assessment. Animals with neurologic disease generally will have a dull or somehow altered mentation. They're not going to respond to you. Again, this is something that you can do as you're walking towards the dog. If he's in, if you're in the room with the dog, you can actually do your respiratory triage and your neurologic triage at the same time, because as you're approaching the animal, you expect the animal to some way or another acknowledge your approach, right? And so that's something we look at. Sometimes, again, it's not subtle. So this cat has some cranial nerve abnormalities here. This is something that you can pick up on your triage exam, but you're not really doing a full cranial nerve exam in the context of triage. But if this cat rolled in on triage, we would absolutely take him take him back for some further assessment to try and figure out what's going on. Because if this is indication of an elevation of the pressure inside his brain, of his intracranial pressure, this could be something that requires immediate treatment. And then the other thing we look at is gait, and primarily I'm concerned with dogs and cats that are paralyzed. If they can't use their hind limbs or their forelimbs, if they try and stand up but they're weak, those are also things that, in my opinion, require some additional investigation following your triage exam. And then urogenital. So essentially, if stuff looks like this, generally we don't leave those people in the waiting room, partially because it's kind of gross, partially because a lot of these mucosal surfaces, so this is vaginal prolapse or paraphimosis, are going to require treatment relatively quickly to prevent damage of the bits that are prolapsed. That is a technical term. Remember, we're using full medical terminology here. Other things, other reasons that we will just take a dog or a cat immediately to the back and do further assessment. Any sort of allergic reactions. If the owner says that the dog ingested a toxin, we will frequently not pass go, not collect $200, bring the animal back for assessment. GDV, which is what this dog has. This dog is in fact not dead. It's just sedated, but obviously has a huge swelling here that is a gastric dilatation volvulus. Hemorrhage, paralysis, snake bites, or if the owner's freaking out, we're just like, you know what, let's just give us the pet. We'll give it some oxygen, we'll figure it out. But at least it kind of keeps things a little bit calm in the waiting room. Oh, the other thing I forgot to mention here, cats, right? So cats frequently have urethral obstructions. And so part of your triage exam on a cat should always be just a quick palpation of the caudal abdomen, just to make sure that you don't feel a rock hard, enlarged bladder, because that is also something that can have pretty severe consequences if you let it sit. So that's why urogenital is even on this list at all. I mean, the prolapse stuff is gross, but if you have an obstruction, a urinary obstruction, that needs immediate treatment. All right. Oh man, I'm running out of time. Okay, great. So as I said, just quickly, really want to focus on your primary survey here, which is just that very brief assessment of all of those important things. After you're happy, if you're happy that all of the primary problems are okay, that there are no issues with the primary systems, then you can take a breath, take a step back, and then do your full physical exam. You can gather data if you need to. You can do, abdominal palpation, musculoskeletal stuff, talk to the owner about history. All of that can kind of be part of your secondary exam. If your secondary exam gets shortcutted because you've identified a problem on your primary survey, then you will kind of be treating that primary problem at the same time that you're getting your other data. This is actually what I just said. Other data, we can collect blood pressures, we can collect pulse oximeter. Your secondary survey for critically ill patients is really just trying to figure out why they presented to you with the problem they presented in the first place. We may also, in that context, place an IV catheter and get some blood work as well, depending on how ill the animal is. Right, so here's respiratory stuff. For a secondary survey, I'm actually just going to kind of skip through these because I've already said it. But basically, if we're worried about respiratory disease, we're going to sculpt the animal, we're going to assess the oxygenation, and finish our physical exam. And sometimes Tanya here is actually, we wanted to get a blood pressure on this animal, and she just crawled into the oxygen gauge with him because we didn't think he was stable enough. He seemed to be really having a lot of difficulty breathing. So to finish up our secondary survey, she just crawled in there with him so he could have oxygen. She could have oxygen. She felt better after it. And then we were all good. We may place an IV catheter and we may check a blood pressure. And then we may intervene as necessary. Cardiovascular stuff, again, we're talking about heart rate, heart rhythm. We're going to talk about blood pressure if we're worried about perfusion. This dog is obviously having a touch of hemorrhage here, so we're going to make sure the dog's blood pressure is normal, trying to stabilize him in that manner. And that's kind of where we go from a cardiovascular standpoint. Neurologically, we really want to check intracranial pressure. And so if we have a dog who is mentally dull, where we're worried about some sort of disease in his brain, usually we'll measure a blood pressure as well, simply because if you're having really high pressure in your brain, you're probably going to have relatively high blood pressure in your systemic measurements. And then usually we give these guys oxygen and then treatment. We have various treatments that can decrease the pressure inside the brain. Okay, don't forget to do a full physical exam. It may not happen all at once. You may have to do some stabilizing things before you do your full physical exam, but don't forget that you've got to do that. This is that same dog, and you can see he's even icteric here, and he's got actually a little bit of bruising as well. This dog, we actually didn't even know how bruised this dog was until we clipped him for his ultrasound. And then it was pretty obvious that he was having really severe bruising. Okay, so I'm just going to go 2 minutes. Again, I apologize for going over. I will apologize for going over every time because okay, Bubba. So we've got his problem list. We did find out that he was receiving non-steroidal anti-inflammatory drugs, which can cause gastric ulcers. And so we suspected, we sort of oozed into our secondary survey here. So we're giving him some oxygen. He's got an IV catheter. We measured his red blood cell count. His PCV was 12%. Normal should be 35 to 40. And so this dog was acutely anemic, which is why he was tachycardic. You can see he's still tachycardic, and we really quickly gave him already 1 unit of blood. That's what happens when you're a Great Dane. So he's now going to have the 2nd unit of blood to try and improve his overall oxygen delivery. Good. So here's just a little bit of terminology, and that is in Utah. But we're going to do some art history as well during some of these talks, but I won't dwell on it today. Can I answer any questions for anyone?
I have a non-medical question. So the class, is it being recorded, or how do we do that part of things?
I am assuming it is. I'm not controlling it though.
Okay, so
don't see any record button.
So the
Oh.
Echo Link isn't even working for this class. We do have a tech genius in our class who is already recording the Zoom session for this time around, but in the
Okay.
future, I don't know if I need to email Dr. Koenig or like IT. Like the Echo Link doesn't even work if you wanted to watch it.
It's coming back to me. I think we have historically not echoed this class.
Okay.
But obviously things are a little bit different now, because it used to be, everyone would actually just show up. I can investigate that. Why don't you can shoot her a note as well.
Okay.
Because I think probably since folks are sort of no longer synchronous, we may need to have these things taped.
Sounds good. Yeah. Like I said, we've got someone who recorded this session in case that is an issue, but.
Excellent. And good. Any other questions?
I also have one. For your lecture slides / lecture notes, do you name them in a specific way for which one you want us to have? Because I think there's 2 separate copies.
Yeah, so they're just written differently. So one of them is just narrative, right? I think, are there 2 copies of actual PowerPoints?
I think so.
All right. One of them is just some slides of pictures of like membrane colors and stuff, as opposed to the full thing. I'll look at it again. We used to mostly have just the just those like 4 or 5 page written proceedings type notes, and then we started uploading the lecture notes, and so it's possible that that's just a leftover one from an older lecture. I'll take a look at it and see what's there.
Okay, thank you.
And then if you're going to read any of the articles there, I recommend the Aldrich one, because she's a great clinician out at UC Davis who's really focusing on like what you need to know or what you need to think about during your emergency physical exam. So I highly recommend that article if you're wanting to do a little bit more reading.
I have one question.
Yeah.
So you said because the teaching hospital is trying to keep numbers low, we don't need to worry about signing up for a rotation right
I
now?
don't think we're, yeah, I don't think we're doing that. I think
Okay.
we are, is that in the syllabus somewhere?
They just told us about it. I think the second years or someone said to make sure that we like sign up early and keep
Yeah.
our date.
Yeah, no, that's not happening this year, unfortunately. Um, it was that we would have groups of 3 or 4 of you all come out and just kind of hang out with us, which was, quite frankly, was kind of fun. But yeah, because we're trying to limit the number of people in the room at any given time, we can't do that this year, which is why we're doing the video thing instead. So yeah,
Okay.
you don't have to worry about signing up.
Thank you.
Sure. All right, great. Well, have a great day, everyone, and we'll see you next week.